Skill. I have my supplies, my ostomy bag, the ring plate, both already applied to the stoma, a pair of clean gloves, 2 clean washcloths, my stoma paste, the stoma guide with cuts already made, and my trash bag. I would first gather my supplies and enter my patient's room, closing the door to ensure patient privacy. I would then place my supplies on a clean, dry, flat surface area. Introduce myself, verify my patient, and explain the procedure. Hello, Mr. Smith. My name is Bessie. May I see your wristband? Can you tell me your name and date of birth? Thank you. So today I'm going to be changing your ostomy bag. I'll start and replacing your ring plate. I'll start by removing the ostomy bag. I'll empty it, inspect it, make sure everything's okay. Then I'll remove the ring plate. Then I'll clean around the skin around your stoma, apply a skin barrier, attach a new ring plate and new ostomy bag. Does that sound all right? Do you have any questions? Okay, we'll get started. I'll begin by setting up my trash bag. Perform hand hygiene. Applying my clean gloves. Remove the ostomy bag from the ring plate. I've now removed it. I will then empty it into the toilet, measuring it if needed, inspecting it, making sure everything looks okay, keeping the clamp if needed. Then I would dispose of this in the trash. For this practice, I only have one ostomy bag, so I'll be using this as if it were a new ostomy bag. I'll then gently remove the ring plate, making sure not to damage the skin. And then disposing this appropriately. For this practice, I only have one faceplate, so I'll be using this as if it were new. I can now clean the skin around the stoma with a warm wet washcloth and an approved solution. Changing the direction of my washcloth. Dispose of this appropriately. Take a dry washcloth. Change the direction of the washcloth. Dispose of this appropriately. I can now inspect the surrounding skin, making sure that there are no concerns for tissue integrity and making sure that the stoma is an appropriate color. I can now measure the stoma, making sure that it is at least 1/8 within the 1/8 of the measuring guide. I've measured the stoma at 1 3/4 inches. I'll then open the new ring plate, dispose of the container, using my measuring guide, measure the appropriate size to the ring plate and cut accordingly. I'll now apply the skin barrier, the stoma paste. I'll make sure that the skin barrier stoma paste is dried and to apply the new ring plate. I would then remove the backing for this ring plate to allow the adhesive side to show, but for the in case of remediation, the purpose of this video, I'll leave these on, but I'll proceed as if I have taken them off. The stoma paste is now dry. I'll now apply the new ring plate, securing the adhesive. I can now apply the new ostomy bag. Again, securing it to the ring plate to prevent any leakage. I'll then clamp the ostomy bag. Discard my waste. I can now remove my gloves. Discard of them appropriately. Perform hand hygiene. Make sure my patient is in a comfortable position. Okay, Mr. Smith, we're all done. Are you comfortable? Okay. I would then leave the room, making sure to close the door again to ensure patient privacy, document the procedure, and communicate with the provider if there are any concerns.